Welcome to DermWire News, powered by DermWire.com. DermWire News for Smart Speaker is made possible with advertising support from Dermatology. I'm Stephanie Talea with Practical Dermatology magazine. States with fewer melanoma diagnoses actually have higher death rates, report researchers at University of Utah Health. The researchers conducted a state-by-state analysis to understand the geographic disparities for patients diagnosed with melanoma. They found lower survival is associated with more practicing physicians in a region and higher population of Caucasians. The results appear online in the Journal of the American Academy of Dermatology. This study is a bird's-eye view of melanoma survival in the United States, says Dr. Zachary Hopkins, resident in internal medicine at U of U Health and first author on the paper. We are interested in finding disparities in state healthcare systems to target specific states to improve care for people. The analysis showed that states with the highest incidence of melanoma, Oregon, Washington, Utah, Minnesota, Vermont, and New Hampshire, have a better survival rate. Conversely, states with a lower incidence of melanoma, Texas, Louisiana, Alabama, Indiana, Illinois, and Nevada, experience lower survival rates. The researchers used the mortality to incidence ratio, or MIR, for each state to approximate survival by standardizing mortality to the incidence of disease. Their analysis identified two factors associated with an increase in the MIR: the number of physicians practicing in a region and the percent of Caucasians in the population. Finding a significant relationship between more physicians and mortality was certainly surprising, Dr. Hopkins says. We believe the sickest patients go to larger facilities with more doctors, which may also be more likely to report disease. Hopkins believes these results offer an opportunity for future targeted approaches through education campaigns, greater access to specialists, and tuning healthcare systems to respond to melanoma. These efforts could reduce the number of deaths associated with the disease across the country. A team of investigators has identified comprehensive guidelines for managing severe atopic dermatitis. The clinical management review was recently published in the Journal of Allergy and Clinical Immunology in Practice. In their clinical review, the researchers incorporate national and international guidelines to deliver a comprehensive algorithm to guide clinicians in treating AD patients as seen in the chart. The steps include making a proper diagnosis and defining severity of AD, addressing the basics of AD care, appropriate skin hydration and use of moisturizers and topical medications, identifying irritants and allergens, treating bacterial, viral, or fungal infections, treating psychosocial aspects, developing an action plan, consultations with an AD specialist, considering acute management with wet wrap therapy, and considering hospitalization treatment with the systemic biologic dupilumab and phototherapy. Save the Date, Practical Dermatology's sister publication, Modern Aesthetics' newest tweet chat series, #RealDealAesthetics, featuring New York City dermatologist Dr. Gary Goldenberg and Charleston, South Carolina dermatologist Dr. Todd Schlesinger is back. The first tweet chat of 2019 focuses on minimally invasive body contouring and will take place on January 30th, 2019 from 8:30 to 9 p.m. Eastern Time. Body contouring is such a hot topic, says Dr. Goldenberg, an assistant clinical professor of dermatology at Icahn School of Medicine of Mount Sinai Hospital in New York City. There are so many options for physicians and patients to choose from, and picking the device that works for you and your practice may be difficult. To join the chat, use the event hashtag RealDealAesthetics and ask away from 8:30 to 9 p.m. on January 30th. Thank you for listening to DermWire News, powered by DermWire.com. This editorially independent program is supported with advertising from Dermatology.